Hello everyone, and welcome back to our channel. Today, we're diving into an exciting topic that's essential for anyone interested in understanding how behavioral changes can be scientifically tested and observed. We're going to explore different experimental designs, including the powerful ABA and ABAB designs, and see how they are used in real-world scenarios to determine the effectiveness of intervention. Whether you're a student, a researcher, or just curious about behavioral sciences, this video will provide you with a clear understanding of these methodologies. So, make sure you're subscribed. Hit that bell icon to get notifications. And let's get started on this educational journey together. Reversal Design Basics has a BA design and a BAB design. For a BA design has phase A baseline. Observe and record the behavior without any intervention treatment to get a baseline measurement. Phase B treatment, introduce an intervention or treatment to see if it changes the behavior. Phase A return to baseline, remove the treatment to see if the behavior goes back to how it was during the baseline. This helps confirm that the changes in behavior were actually due to the treatment. Advantages of a BA design. Clear demonstration of effect. By observing what happens when the intervention is removed, researchers can more confidently assert that changes in behavior were indeed due to the intervention. Ethical and practical in some cases. When it is safe and ethical to remove the intervention, this design helps confirm the necessity and effectiveness of the treatment. When to use. When the behavior under study is reversible and removing the intervention does not pose ethical concerns. When initial observations without intervention are crucial for understanding the behavior's baseline. A BAB design is a strengthened version of the ABA design. After the initial 3 phases, the treatment is reintroduced phase B again to see if the behavior changes in the same way as during the first treatment phase. This cycle strengthens the evidence that the treatment is causing the change. ABAB has stronger causal inference. By reintroducing the intervention in the second B phase, the ABAB design strengthens the evidence of causality between the intervention and the behavior change. This repeated exposure helps confirm that changes in behavior are indeed due to the intervention, rather than other, external variables. Ethical benefits. Ending with the intervention phase second, B is often seen as more ethical, particularly if the intervention is beneficial. This ensures that participants are not left without a potentially helpful treatment after the study ends. Replication within the study. The second cycle, second A and B, acts as a replication, which adds reliability and robustness to the findings. This internal replication helps ensure that the effects observed are not due to chance. Flexibility for adjustments. The ABAB design allows adjustments to the intervention during the second B phase, based on observations made during the earlier phases. This can be particularly valuable in clinical settings where ongoing adjustments based on client response are necessary. Enhanced data for long-term planning. By observing how behaviors change across 4 phases, rather than 3, practitioners gain more data on the intervention's long-term effectiveness and sustainability. This can inform more comprehensive treatment plans and support sustained implementation strategies. Variations of the ABAB design. 1. Extended reversal ABAB. Continuing to alternate between treatment and no treatment can provide even stronger evidence of the treatment's effect. 2. BAB design. Sometimes, starting with the treatment B is necessary, followed by a return to baseline, AN, and then reintroduction of the treatment B. This is used when starting without treatment isn't practical or ethical. 3. Multiple treatment designs example, ABAB-CBC. These designs test more than one treatment by alternating them with the baseline and each other to compare their effects. Let's look BAB design. Immediate treatment. This design begins with the intervention B, which is particularly useful when it's deemed unethical or impractical to observe the behavior without intervention due to the severity or nature of the behavior. Assessment of necessity. After the initial treatment phase, the intervention is temporarily withdrawn, allowing researchers to observe whether the behavior reverts to its baseline state, indicating the effectiveness of the intervention. Reaffirming intervention necessity. The intervention is reintroduced, B, confirming its efficacy as the behavior changes are observed again. Advantages of BAB design. Ethical considerations. More ethical in situations where withholding initial treatment could result in harm or severe discomfort. Immediate effects. Allows immediate assessment of the intervention's impact, important in acute or severe cases. When to use. In cases where the participant's well-being could be compromised by not starting with the intervention. When participant retention might be challenging without immediate benefits from the treatment. When it's important to demonstrate the necessity of ongoing intervention to maintain behavioral improvements. Referral techniques. 1. Non-contingent reinforcement (NCR) examines the role of reinforcement when it's given without being linked to the target behavior. 2. Differential reinforcement (DRO) DRIDRA analyzes effects of providing reinforcement only when specific alternative behaviors occur, rather than the target behavior. Considerations for using referral design. Inappropriateness for certain treatments. Some interventions, like educational instructions or once-learned skills, can't be unlearned, making them unsuitable for reversal designs because you can't remove the effects. Behavioral irreversibility. Some behaviors, once changed, might not return to baseline, even if the treatment is withdrawn. Ethical concerns. Removing an effective treatment to prove it works might not always be ethical, especially if it deprives someone of needed help. Let's look some details for considerations. Inappropriateness for certain treatments. Example. Teaching reading skills. Situation. Teaching a child how to read involves complex, cumulative educational instructions that build on each other. Issue. Once a child learns to decode words and comprehend text, these skills cannot be unlearned or removed. Trying to assess the impact of reading instruction by removing it doesn't make sense because you can't erase the child's ability to read to see if they revert to pre-reading behavior. Implication. This makes educational interventions like reading instruction unsuitable for reversal designs, because the effects of the intervention cannot be completely withdrawn. Next, behavioral irreversibility. Example. Training for emergency responses. Situation. Emergency personnel, such as firefighters or paramedics, undergo intensive training to improve their response times and procedural accuracy during emergencies. Issue. Once these skills are acquired and internalized through repetitive training and real-life application, the behaviors associated with these skills are unlikely to revert to pre-training levels, even if the continuous training stops. Implication. This kind of behavioral change is essentially irreversible, because the trained reflexes and responses are ingrained and do not simply disappear. Third, ethical concerns. Example. Medication for chronic conditions. Situation. Consider patients who are on essential medications for chronic conditions like diabetes or hypertension. Issue. If a study uses a reversal design where medication is temporarily withdrawn to validate its effectiveness, patients could suffer severe health consequences during the withdrawal phase. Implication: it's unethical to remove an effective treatment purely for experimental purposes. When doing so, risks significant harm to the patient. Such a strategy deprives them of necessary medical care, posing serious health risks. Key reasons using reversal design: to establish cause and effect relationships. Purpose: the primary advantage of the reversal design is its ability to clearly demonstrate that changes in behavior are directly due to the intervention. How it works: by observing the behavior before, during, and after the implementation of an intervention, and then again when the intervention is removed. Researchers can see if the behavior changes correspond with these changes in conditions. If behavior improves with the intervention and worsens without it, this suggests a causal relationship. To confirm the necessity and efficacy of interventions. Purpose: it helps validate the necessity of the intervention for maintaining improved behavior. Application: this design is especially useful in educational and clinical settings, where it is crucial to demonstrate that a particular treatment or strategy is responsible for behavioral improvements, ensuring that the most effective interventions are utilized. Key reasons using reversal design: to enhance intervention strategies. Purpose: provides feedback for refining interventions. Details: by monitoring how behaviors revert when interventions are withdrawn, practitioners can understand more about the condition under which behaviors occur and refine their strategies accordingly to maximize effectiveness and efficiency. To address ethical considerations. Purpose: to justify the continued use of interventions. Scenario: in some cases, especially involving irreversible treatments or those with significant side effects, demonstrating clear, reproducible effects can justify the ongoing use of the intervention, ensuring that the benefits outweigh any potential risks. Key reasons using reversal design: to reduce confounding variables. Purpose: controls for external factors that might affect the behavior. Benefit: by reintroducing and removing the intervention in the same environment and maintaining other conditions as constant as possible, the design helps rule out other variables that might be influencing the observed outcomes, thus attributing changes in behavior specifically to the intervention. Flexibility in application advantage: suitable for single-subject designs where large sample sizes are not available. Context: particularly in cases where individualized treatment is necessary, such as in therapeutic settings for specific disabilities. Reversal design allows for detailed, personalized analysis of how interventions affect individuals, guiding personalized treatment plans. Let's practice with some mock exams. Mock Exam 1. A researcher wants to demonstrate the effect of a new educational program on reading comprehension over time, ensuring the results are not due to chance. Which experimental design is most appropriate for this scenario? 1. ABAB design. 2. ABAB design. 3. Multiple baseline design. 4. Withdrawal design. Correct answer is 2. ABAB design. The ABAB design allows for the treatment to be tested, withdrawn, and reintroduced, providing strong evidence of its effectiveness by replicating the effect within the same study. 3. Multiple baseline design is typically used when different behaviors settings, or subjects are introduced to the intervention at different times. Not for demonstrating causality in a single behavior. 4. Withdrawal design is similar to ABAB, but ends with the withdrawal of the intervention, potentially leaving participants without beneficial effects. Mock Exam 2. A clinician needs to compare the effectiveness of two different behavioral interventions for reducing anxiety without removing either entirely. Which experimental design is most suitable? 1. Reversal design. 2. Multiple baseline design. 3. Multielement design. 4. Withdrawal design. Correct answer is 3. Multielement design. Multielement design allows simultaneous comparison of different conditions, providing rapid assessment of each intervention's effects. 1. Reversal design and 4. Withdrawal design. Both involve removing the intervention to observe potential reversals in behavior, not suitable for simultaneous comparison of two interventions. 2. Multiple baseline design is more suited for observing behaviors across different conditions or subjects, but does not allow for the direct comparison of two treatments simultaneously. Mock Exam 3. Which option is not an advantage of using a reversal design? 1. Strong demonstration of causality. 2. Ability to test the durability of the treatment effect. 3. Simplicity in setup and execution. 4. Ensuring participant safety by reintroducing beneficial treatment. Correct answer is 4. Ensuring participant safety by reintroducing beneficial treatment. Reversal designs involve removing the intervention, which can pose risks if the intervention is beneficial, thus not inherently ensuring participant safety. 1. Strong demonstration of causality. This option is indeed an advantage of the reversal design, offering strong causal evidence. 2. Ability to test the durability of the treatment effect. And 3. Simplicity in setup and execution. Both are advantages, demonstrating the design's utility and straightforward nature. Mock Exam 4. Which option is not a disadvantage of the reversal design? 1. Potential ethical concerns with withdrawing beneficial treatment. 2. Difficulty in generalizing results due to single subject focus. 3. Guaranteed safety in reintroducing beneficial treatment. 4. Possible effects of treatment cannot be completely reversed. Correct answer is 3. Guaranteed safety in reintroducing beneficial treatment. Reversal designs do not guarantee safety when reintroducing treatment, especially if the withdrawal phase causes deterioration or harm. 1. Potential ethical concerns. And 2. Difficulty in generalizing results. These are true disadvantages of the reversal design, highlighting ethical and practical limitations. 4. Possible effects of treatment cannot be completely reversed. This also is a disadvantage, especially for behaviors or treatments with lasting impacts. Mock Exam 5. An intervention is known to have irreversible effects once implemented. Which experimental design is least appropriate for this scenario? 1. ABAB design. 2. Multiple baseline design. 3. Withdrawal design. 4. ABAB design. Correct answer is 1. ABAB design. ABAB design involves withdrawing the intervention, which is not suitable for interventions with irreversible effects. Multiple baseline design, withdrawal design, ABAB design are all potentially involve removing or reversing the intervention. Not ideal for irreversible treatments. Mock Exam 6. You want to observe the behavior change in 3 different settings independently to understand the effect of contexts. Which experimental design would best suit this study? 1. Multielement design. 2. Multiple baseline design. 3. ABAB design. 4. Withdrawal design. Correct answer is 2. Multiple baseline design. Multiple baseline design allows for the independent observation of behaviors across different settings, without needing to withdraw interventions. Multielement design, ABAB design, withdrawal design are less suitable for studying independent effects across settings, as they focus more on the comparison of conditions or the effect of interventions being introduced and removed. Mock Exam 7. A behavior analyst wants to determine if a behavior modification technique is effective but reversible. Question: which design is most appropriate? 1. ABAB design. 2. Multiple baseline design. 3. Withdrawal design. 4. Multielement design. Correct answer Ison. ABAB design. ABAB design is ideal for testing the reversibility of an intervention's effects by reintroducing it after withdrawal. 2. Multiple baseline design does not involve the withdrawal or reintroduction of interventions. 3. Withdrawal design. And 4. Multielement design focus on removing or comparing multiple treatments, not on the reversibility of a single intervention's effects. Mock Exam 8. An experiment requires rapid assessment of multiple treatments to determine which is most effective in a short period. What is the best experimental design for this requirement? 1. Withdrawal design. 2. ABAB design. 3. Multielement design. 4. Multiple baseline design. Correct answer is 3. Multielement design. Multielement design allows for simultaneous comparison of different treatments, ideal for rapid assessment. Withdrawal design, ABAB design, multiple baseline design do not allow for the rapid assessment of multiple treatments simultaneously, as they focus more on the sequential introduction and removal of a single treatment. Mock Exam 9. To assess the long-term effects of a behavioral intervention after its withdrawal, which design should be used? 1. Withdrawal design. 2. ABA design. 3. ABAB design. 4. Multiple baseline design. Correct answer is 3. ABAB design. The ABAB design is effective for assessing long-term effects by allowing for the reintroduction of the intervention. 1. Withdrawal design typically ends with the withdrawal of the treatment, not reintroduction. 2. ABA design also ends with the removal of the intervention, not allowing for assessment after reintroduction. 4. Multiple baseline design does not involve the cyclic reintroduction of treatments. focusing instead on staggered introductions. Mock Exam 10. Which experimental design allows for the simultaneous assessment of the effects of different variables within the same study? 1. ABAB design. 2. Withdrawal design. 3. Multiple baseline design. 4. Multielement design. Correct answer is 4. Multielement design. Multielement design facilitates the analysis of multiple variables simultaneously, providing comparative data within the same experimental setup. ABAB design, withdrawal design, multiple baseline design. None of these designs allow for the simultaneous assessment of different variables or treatments, as they focus on sequential or staggered approaches. Thank you so much for watching our video on experimental designs in behavioral research. I hope it helped clarify how these designs can be effectively used to test and demonstrate the impact of various interventions. If you found this video informative and would like to learn more about topics like this, don't forget to like, subscribe, and click the bell icons so you won't miss our future videos. Feel free to share your thoughts or any questions you might have in the comments below. We love hearing from you and are here to help deepen your understanding. Thanks again for tuning in, and see you in the next video.